Mental health cases are on the rise in the country, yet bipolar disorder, a mental health condition that causes extreme mood swings, remains misunderstood. Those suffering from the condition often face stigma, leading to withdrawal and remaining silent in their suffering. Tonight, we highlight the story of Samuel Ochieng Okeyo, a resident of Umoja, Nairobi County, who has battled bipolar disorder for over 2 decades and who is using his experience to shed light on a condition affecting many.
At the onset of this condition, I used to be low. Sometimes I'm depressed. Sometimes I cut off from people. You can't even shower. You can't even eat. You can't get out of bed. And sometimes the mood has shifted to the other extreme end. And now you are excited. You have ideas. You want to meet your friends, and you don't understand yourself. All these people around here were my friends, but they didn't know I have this organization. So when I started it, the reception was very good because they had challenges that I am addressing.
Tutapata kuna time kama sisi mavijana huwa ni ngumu kwetu ku open up about issues kama hizi za employment for example. So kuna ile time tumekuja tuna engage na yeye tunaongea, unapata watu wanajifungua roho, wanaongea zile mashida wako nazo.
There are types of bipolar disorder. We have bipolar 1, bipolar 2 and cyclothymia. The most challenging one that we're dealing with is bipolar 1. Bipolar 2, it can be managed. Cyclothymia, it's not that severe, but it's chronic, lasts over a longer time. It's mostly prevalent in women, and it affects most onsets. You'd see them between late adolescence and early adulthood.
According to experts, Kenya faces a shortage of mental health professionals, with only a handful of psychiatrists and psychologists serving a population of over 50 million. Access to treatment is also a challenge, as many Kenyans cannot afford medication or therapy sessions.
At the onset of this condition, my brother used to spend at a minimum 300,000 per hospital visit.
When you're admitted, the costs are very high. So if they're able to offer with the SHA, incorporate a way to finance this, because it's not easy.
Despite these challenges, experts say bipolar disorder is manageable with proper medication, therapy, and support from family and friends. Both Samuel and Kenya speak passionately about the need to break the stigma surrounding bipolar condition.
In the year 2002, I joined the University of Nairobi to study sociology and economics. Because of this condition, I failed in 16 units. Because of stigma, isolation, you can't even go to class because people are talking about you.
So there's stigma because people have not understood what bipolar is, and they tend to judge the people's behavior by assuming that it's a choice they have. So one thing I would say, people need to get educated, understand what bipolar is.
Samuel's story is a powerful reminder that mental health conditions like bipolar disorder can affect anyone, regardless of their background. With increased awareness, better healthcare policies, and community support, the country creates an environment where people feel safe to seek help.
There's help if people accept themselves. People are living in denial. You find somebody is having depression, but he doesn't want people to know about it. He doesn't want to seek help.
So for anyone who is struggling with mental health, I would say you're not alone. There are so many resources that we have to support you and to help you walk this journey.
For Channel One News, I'm Joseph Wahungu.